Asthma is a disease that can be easily controlled, but in most developing countries, many still die due to a lack of effective management of this particular condition. As we mark Asthma Awareness Month, let's look at how South Africa is managing the illness. I'm now joined by Dr. Corli Lodder, a GP with special training in allergies and asthma and a member of the Allergy Foundation of South Africa. Dr. Lodder, appreciate your time this afternoon. Unpack for us current asthma statistics in South Africa and obviously what asthma is.
Hi Hugo, it's so nice to join you guys because yes, as you said, May is Asthma Awareness Month, and in South Africa we really are not always getting this right. So asthma is a chronic inflammatory condition of the airways leading to changeable and variable airway obstruction and inflammation and limitation to airflow caused by specific triggers. It's not always the same. A whole big percentage of asthmatics has got allergic asthma, but it's not the whole story. And the biggest problem that we have is to actually get patients to comply with the asthma medication, because not a tablet that you swallow, it's actually an inhaler that you need to use. And also to get that inhaler deposited in the lung where the inflammation is. So hitting the target is the problem.
So we know it's treatable. Is it curable though?
Not in most cases. And if I hesitant there, that in some instances in allergic asthma that we can do immunotherapy, which is not registered in our country, we can desensitize, and it is actually disease modifying. So let's say no, it's not curable, but it is most definitely treatable and controllable.
Now, you did mention that in certain instances asthma will flare up for some individuals, and obviously it has many implications on how individuals with asthma live their lives. Many can't run, can't participate in sports, or have to manage how they participate in those activities. Would you care to expound on that?
Absolutely. So I think that is where my passion comes from, and where the Allergy Foundation also comes from, because there are just far too many people, and especially children, sitting on the pavilion saying that, no, I can't run with my friends, and I can't play rugby and netball, and I can't do the park run because my chest will close up. And that's the whole problem, that if you are symptomatic, the inflammation is in control, and then we need to step up your medication. We really do have wonderful treatment available. And if patients would just talk to us and not only rely on their reliever inhaler, where we would just puff away if we've got symptoms, it's that everyday treatment or more frequent treatment for your inflammation. Every child should be able to run with their friends and play with their dogs and go through a winter with a viral infection without putting them in hospital. Yes, they might have more symptoms, because just as a diabetic needs to do the carb counting and decide how much insulin they are going to use today according to that plate, but they've got control. If I walk out of my door in George, where we have got 4 seasons in one day, I do not know what's going to trigger me. But if my controller medication and my treatment plan is good enough, I can manage and I can do a normal life. And that's what the Allergy Foundation is about. Asthmatics should be able to have a normal life and win the Olympic gold at swimming, like one of our Olympic gold medalists that is asthmatic can do. That is how well we can control asthma.
Now, you've suggested, Dr. Lodder, that the information that those that are asthmatic have is sometimes not the right information. And I'd imagine that the problem arises at the point of diagnosis, and obviously the information that is imparted to the individual or to the patient. Are you suggesting, though, that those that sometimes diagnose individuals with asthma do not give them sufficient information about how they can live their lives as normally as possible?
I think so. Hugo, I think the awareness in our country is a lot focused on cardiovascular disease, infectious diseases, because we have a huge battle with AIDS and TB and a lot of infectious diseases. Cancer is this dreaded diagnosis. You know, people play down asthma. I will outgrow it. It will get better. Or they use the inhalers and they are better because it's seasonal, being aggravated either by pollen in the peak season or also being aggravated in winter by viral infections. And once they're better, they're kind of, okay, we arrived. Most of the time, chronic inflammation goes through cycles, but that chronic inflammation is in the background. And unfortunately, because it's not a tablet, compliance is poor, and the knowledge about the treatment of allergic conditions in our country, even at medical school, doctors were not trained well. It's changed a lot in the last 10 years, I must really admit. But when I trained, it was really not chronic inflammation, and there's really no need for asthmatics to use their medication all the time. And now we know that it's really, really important. So knowledge is lacking in our country, but even at state level, the medication are available once the diagnoses are made. So my pledge and the pledge of the Allergy Foundation is that if you are symptomatic, if you are battling to breathe, go back. Go and talk to the doctor. Go and talk to the sister at the clinic and get the right medication. But then we still sit with that battle of it's an inhaler. And children and a lot of elderly, and if we do not give education how to use the inhaler, we'd miss the target. If you pop a pill, you pop a pill. That's not difficult. But if you have to give an injection, or if you have to use an inhaler, there's treatment involved. And that's difficult. In state, but also if you think about the huge pharmacies, there's this whole queue and everybody needs to get their scripts full. And the pharmacist doesn't have the time to educate. The doctor doesn't do that. And that again, Allergy Foundation is a great platform to go and get some information. And that's what we are all about.
Now, you talked about the inhaler, and I'd like to imagine that the inhaler is any individual with asthma's best friend, because we see them all around. In fact, the hand and glove, if you will. What does the inhaler actually do for an asthmatic person?
So there are different kinds of inhalers. So if you use an inhaler, I should actually have had a sample here, but everybody knows the pump that you press at the top and you inhale it, and there's some powder devices also. So lots of the time on television we would see, like in a movie, people are puffing away on the symptom relief inhaler. So that just takes away the symptom of being breathless for that moment. But it doesn't control the inflammation. So there are also controller treatment, and that you should be using every single day or at least during the time that you are exacerbating, but preferably every single day. And then you have your reliever when you have symptoms. Now the guideline says that every time you need to use your reliever opening your airways, you should always use your inhaled corticosteroid with that, because that's the inflammatory treatment. There are also some of the inhalers that have a combination of a reliever, quick acting and long, which we call formoterol, but it also contains the inhaled steroid. And that word people do not want to know because they don't want to use steroids. But you must understand that if we are inhaling steroids, that's micro dosages inhaled in the lung. It's not systemically absorbed like drinking a tablet or drinking a syrup that will have all the detrimental side effects and negative connections that we have with steroids. So if we inhale steroids, that controls the inflammation. The problem is that inhaler, we have to coordinate now. You have to press down. You already have to start inhaling and then press down while you're still inhaling to slow down that plume. And that is why we actually promote in the little ones and the elderly using a spacer because that is better lung deposition. And in some of the in-between, the bigger children and younger adults can use a powder device where you actually just suck. And it's a powder device and it's easier to use.
Final question, Dr. Lodder. Now, we've talked about those that have asthma, but let's talk about us, the bystanders and family members of those that do have asthma, and there is an emergency and someone does not have their inhaler standing by. What is it that people can do when there is an emergency?
If there's an emergency, then you go to hospital, you go to the clinic, because there's nothing else. That person's lung closed. So to get medication in there, you have to have it inhaled. And that's part of, unfortunately in South Africa, we are still number 5 on the mortality rate of asthma in the world. And it's unfortunately because people go for help too late. So I think the best thing that family members and friends can do is to be supportive, because people often feel, especially the adolescents, they feel self-conscious because they need to use a pump. Be supportive and say, we know you've got asthma. Please feel free to use your inhaler. You are tight. I can hear when you start laughing that you're a little bit tight. Shouldn't we go and seek medical help? So that's the important thing. Not to wait too long, because if you only have a bronchodilator, only a reliever treatment, and you puff away on that, but it's not giving you relief, you are going to land up in trouble. You need a steroid on board. You need to go to hospital. You need oxygen. Support in using your medication correctly and regularly, and go for help if you need it.
Dr. Lodder, appreciate your time this afternoon. We were speaking to Dr. Corli Lodder, a GP specializing in allergies and asthma, as we commemorate Asthma Month.